All right, West Tennessee, when you're ready.
Thank you. Thank you. Hello, my name is Vicki Lake, and I am the project director, and I am with the West Tennessee Healthcare Foundation in Jackson, Tennessee. My colleagues from our Impact Council, from our collaborating agencies, are all here today throughout the audience, and I have two of our colleagues here who will help with the question and answers. I want to thank the Tennessee Department of Human Services and this committee for allowing us to be a part of this pilot project and allowing us to present our implementation plan to you. You can see our vision and our value proposition where we want to decrease dependency on the state and improve people's situation and end poverty and position people to overcome barriers and reach success. When we did our initial application and continued with our grant application, we have looked at 6 barriers that we feel for this population. One is a lack of child care. And when we say child care, access has been mentioned, but we specifically are looking at infants and toddlers along the way because a lot of the population cannot be successful because of young children. We are looking at limited transportation in a rural area. Only one county, Madison, has a Jackson Transit Authority. We have people who don't understand they're not banking, they are underbanked, and we have people who do not understand even how to manage the money that they have. We have a limited accessibility, affordable housing. People do not have a primary care home. They are using emergency rooms throughout the area for their primary care, and we need to better link them with primary care in the region. And then lastly, we have low education and workforce development attainment in our area. We are rural West Tennesseans here today that want to work with rural West Tennesseans. We are going to serve the 20 rural counties in West Tennessee. We have 2 target populations. The first population is people living in poverty, and 19% of this area are living in poverty. Then we also want to work with the ALICE population. And the ALICE population are the working poor. Those are people who make above the poverty level, but under the cost of living in that county. 31% of the people in this area are considered the working poor. So these are our 2 populations. Again, we are looking at child care, transportation, financial empowerment, affordable housing, health services, and education and workforce development. Those are the barriers that we are going to work on. So what is our strategy? Our strategy over an 18-month period is to implement family impact centers in all the counties, in most of the counties in rural West Tennessee. These family impact centers will not be freestanding new centers. We are going to locate them and co-locate them with existing entities, family resource centers, community colleges, American Job Centers. We are going to locate them throughout West Tennessee in those areas. All of them will be staffed by a family champion. The family champion is the first person they will meet. This person will have their back. We learned from interviewing TANF clients, former TANF clients, that one person who helped them and had their back was important. So this person will do an assessment of them. We will also have financial empowerment counselors that will meet with them and help them with their budgeting, their finances, because that's such a part of this. We have other entities that will help. We will have a career specialist who will come in from the American Job Centers to work with them. We will, through West Tennessee Healthcare, have a parent as teachers home visiting model that will work with families who need in-home work to help them. I will note the Family Champions and the Financial Counselors United Way of West Tennessee will be operating those parts. We will be using our human resource agencies and contracting with them to provide transportation in this rural area. We will have mental health professionals who will come in to these family impact centers to work with these clients to help them with any mental health issues they may have or their children. And then lastly, we will have housing navigators. These are provided at no cost to the grant. These are provided by the Department of Housing and Urban Development's Continuum of Care for the Homeless housing navigators, and they will come in and work with people who need housing. We also will have a mobile one-stop shop that the clients can use on their phones to get information that we will provide them about the services that we will be having. We do meet 3 of the TANF alignment. We are aligned with them. We provide assistance to needy families. We are ending dependence on government benefits through work and job preparation, and we want to increase their economic stability. So as you can see, our Impact Council, the backbone agency is the West Tennessee Healthcare Foundation, and we have 5 additional agencies who will be part of this Impact Council. As you can see on the right-hand side, a number of our letters. We had over 50, I believe 50 letters of support from community agencies. We held 3 to 4 Zoom calls throughout the planning time with agencies throughout West Tennessee. So we have a myriad of support for all the components for helping with wraparound services. Our anticipated outcomes. What we have done is we have both process outcomes and then outcomes that show end result. Our process outcomes just look at how many people have we served. But then our outcomes, our other outcomes show what is going to happen to these people. It's okay that you serve 200, but what really happened to them? So we have a number of outcomes. What we are doing with infant and child care is we are going to provide incentives to local child care agencies to increase the number of infant and toddler slots that they have. They may say they serve infants and toddlers. They only have 4 slots and they're full all the time. So what we need to do is increase those slots so this population will have an avenue for child care. We are going to do home repairs for eligible clients that own their homes. We have budgeted for 30 homes a year to provide up to $30,000 in home repair. We also, through the navigators, estimate that 150 to 200 people will be placed in permanent supportive housing through our program. We will we figure about 200 families will be referred to primary care. We have a number of rural health clinics. We have 4 or 5 federally qualified health centers. That we have nonprofit health clinics that we need to, all over West Tennessee, that we need to refer these people to instead of using emergency rooms for primary care. They just don't know where to go. And they need someone to help them get that barrier, and then through our transportation, we'll be able to get them to the clinics. We have financial counselors that will help the people. We will have mental health centers, alcohol and drug recovery ports. We have basic access to GED. You know, a lot of these clients just need basic GED to start with before they can even move into a technical college, the College of Applied Technology, or to a community college or to a 4-year school. They need basic GED, and it's provided free, but we need to make sure they get connected to that. One other thing, we realize that a lot of this population may have a felony. So what we want to do is within the first 6 months to the end of the first year, develop a list of felony-friendly employers, so that when we sit and work with these people, we will know what employers to match their skill or their education or helping them to an employer that is friendly to felons and will work with them. So in our budget, I want to say, first off, on our budget, the West Tennessee Healthcare Foundation is not going to claim any indirect cost in our application. None. All our funding will go to direct services. The foundation is hiring several staff to oversee the work, but all of that will be a direct cost. Most of our expenses are contracts that we will have with our partners. Our partners provide transportation, home visiting, financial empowerment, the family champions, a lot of the child care incentives. We have, most of our money is going to go to work with our partners who know West Tennessee as well to serve our two populations. Now, if you look at the in-kind support that we have, our Impact Council are all giving our time. The Housing Navigators is about a $200,000 commitment for their time from our Continuum of Care HUD grant that we have in West Tennessee. The career specialists that we will have to come meet with the people are from the American Job Centers. We have community colleges, the TCATs, adult education colleges and universities who will be giving their time. And then Pathways Behavioral Health Services has a Tennessee Resilience program that they have received funding through the Department of Mental Health and Substance Abuse Services that will be coming, as well as other mental health professionals, to come to our impact centers to provide services. So those will be in kind to this larger project. How are we going to sustain this? As many of you know, the Ford Motor Company is coming to West Tennessee to employ about 6,500 people for their new Blue Oval plant. When we did our research in planning this, we understand the Ford Foundation has funded these same family impact centers in Detroit, all through Detroit. So we have been in preliminary discussions with them in the long term, because they're not scheduled to, I think, open 2025 and then scheduled to really be fully staffed a couple of years after that. So we are talking to them about helping us sustain these family impact centers based on their prior experience in Detroit, and the applications would be to the Ford Foundation, as we understand.
In summary, we would like to
West Tennessee.
We'd like to play this short video for you that summarizes our whole project and gives you an ideal picture of what this will look like.
West Tennessee families face a number of pressing issues. Their median household income significantly trails the rest of the state. Almost half of families are ALICE or living in poverty. 48% of the population lives in a child care desert, and 81% are income eligible for federal nutrition programs. And then there's the cliff effect. As families increase their earnings with a new job, assistance with child care, or other services, they are often too quickly stripped of the benefits that provided them a safety net, plunging them back into instability. That's why a cross-sector of organizations have partnered together to develop the West Tennessee Dream Initiative, a regional strategy designed to address pressing issues within the community, such as lack of access to child care, affordable housing, health services, and transportation, while increasing financial empowerment and access to education and workforce development. West Tennessee Dream will enable us to create a more effective and efficient system of care within the region. Empower West Tennessee families to pursue their dreams.
I want to thank you. We'll take questions, remembering that West Tennessee Dream, we want to develop, we want to reach, empower, assist, and motivate. So thank you, and we'll take your questions.
Got a couple. First, housing navigators are only as good as the housing stock. So is there some aspect of this to encourage building more affordable housing? Otherwise, all the navigators in the world aren't going to be able to place somebody. That's the first question. Second, similarly, do you have the permanent supportive housing in place now? I've done a lot of work with permanent supportive housing, and it's very expensive. So do you have it in place so that people will have a place to go, or is this something that will have to be developed during the course of your program? And then finally, you mentioned the benefits cliff. And by the way, you're the only people so far who've mentioned housing, so I really dig that. But do you have an approach to addressing the benefits cliff that you just showed?
Absolutely, great question. So to the first, yes, we actually have a collaborative in West Tennessee that has been meeting really since the Ford announcement because we recognize how much that's going to transform West Tennessee. And so we have to have that housing stock ready. And so those conversations are happening currently, and we're seeing investors beginning to come into West Tennessee to begin to build that stock. To that second question, while there are, as was mentioned, our housing navigators, one of their key components is to connect them with, so primarily it's going to be coming from Tennessee Homeless Solutions. So they're going to be connecting them to those partners, such as Jackson Housing Authority, the Dyersburg Housing Authority. There were several of those listed on that partner screen, and so we have key partners with them who will be keeping them up to date on what stock is already available. And then remind me, please, of the third question. Absolutely. So one of the things that is unique to our particular proposal are our Financial Empowerment Center counselors. And so those individuals will utilize the CLIF dashboard that's been created by the Atlanta Federal Reserve Bank to actually guide families through that process. So let me kind of break that down a little bit. And so as we know, if a family signs up for our program to access benefits such as Families First or Smart Steps, well, if we're actually successful in what we're doing and guiding them through this on their journey, they're going to hit that cliff at some point, right? Those benefits are going to go away. Well, with the dashboard, our counselors can actually help them know when that cliff is coming. So we can actually look out 12 to 24 months and say, this is when that cliff is going to come. Here's how we're going to provide all these other wraparound services and support for you to plan for that and to be able to get through that season with the support that you need.
Part is what from your perspective is different or innovative about West Tennessee Dream than the current order?
Yeah, absolutely. So when we think about collective impact, part of what collective impact requires is that there is a common agenda, that we all agree on what the problems are, and that we're all working towards a common solution. And what we've realized through partnering together over the last several months is that all of us have provided great services from our own individual organizations, but we haven't been as effective or as efficient as we could be. And that's going to be what's different now with West Tennessee Dream, is that we're partnering all across the region in an effective and efficient way, communicating, setting the agenda, having a backbone agency that facilitates that every single day. That's what they wake up to do, to guide that process. But then the other piece is the family impact centers, the one-stop shop locations. There's nothing like that has existed. As many of you know, right now, how the process works, if I want to come and get access to SNAP benefits, I have to come over here. But then I also have issues with transportation. Well, I got to go get a bus pass over there. Oh, well, I have this work thing. I got to go over here. Now we're providing one-stop shop locations where that all happens in one place for a family. They're not being bussed all over the place, riding on a bus for 8 hours of the day, trying to get something done that would take 30 minutes.
Gotcha. And the second part of this for me is you speak in a compelling way to really referral, connecting, and leverage. What I didn't hear a lot of is what defines success of this from your perspective?
I think what defines success is what DHS is looking for itself, which is that because we can use that dashboard, because we can have those wraparound services, we can actually get people off of government dependency. That's success. Success is moving them from where they are to a job opportunity, to education, to childcare, to all of those other pieces temporarily, right? We're providing that temporarily. So it's a short-term solution for a long-term success for families. And so that's the piece that I think is very different for us, is that we ultimately, our chief goal of all of this is to actually help people get on their feet.
Hey, Lisa Piercy. Obviously, I'll have to recuse myself from this one based on my history. But one comment, one question. The comment is, as Jerry talked about, you're the first one to talk about housing. You're also the first one to talk about home visiting. And from both a pediatric and a public health standpoint, home visiting is one of the most evidence-based programs, not only for child development, but reduction in child abuse, job placements for moms, early childhood development, and health. So thank you for including that. My question is, how do people learn about these family centers, and how did they get there?
That's great. That's almost a setup, isn't it?
I promise, nobody told me to ask that.
So I think that that's the other thing to go back as well of what's innovative about our approach is the first place of contact will be home visitors that will be connected with new mothers and new families at clinics and at hospitals when those babies are on their way to being born and when they're born. The second place of connection will be through those family champions, which if we've missed them when they've been born, we catch them when they're signing up for childcare. And we're catching them then and wrapping them in. And then the third place of connection and contact and referral will be all of our wraparound partners. It's our collective impact mission. All of those partners will then be making referrals directly to our services from the rest of the rural counties. And that's why having those family impact centers located regionally is so important, because it makes those connections easy. With our partners from the human resource agencies providing transportation, we can ensure, generally speaking, that no one will be more than about 20 minutes away from one of our family impact centers. And that also makes it innovative and unique.
Thank you very much. Talk a little bit more about that. Your slide that shows someone holding a cell phone in the online app. How are we going to make these devices available to families? Is there a funding mechanism in there to allow technology to come into these families to stay connected with their family champion? And I've got a follow-up too.
Yeah, absolutely. I actually think that that's one of the biggest misconceptions and one of the most common myths. In our research and interviewing our families, almost everyone has a cell phone. They have devices. They have access. That's not missing. What is missing is what we're proposing here, which is a simple solution to let them know where their resources are. And so one of the things that we found in West Tennessee over several years, we always produce these resource guides. Well, the problem is that the resource guide is obsolete 2 weeks after it's produced because things change. So having an online version of that keeps it up to date. We have partners already. It already actually exists. And so it's already there, ready to serve families. And then what was the second question again?
I haven't asked it yet.
Okay, there we go.
The follow-up, and you show the slide on Blue Oval City, and legislatively we have embraced what's coming with Ford Motor Company and the opportunities there for West Tennessee and the region. You mentioned the partnership that Ford has in Detroit. Give me an idea of what the outcomes have been in their prior partnerships with entities in Michigan.
Yeah, so they have two impact centers, or family resource centers is what they call them in Detroit. They also have one, I believe, is in Singapore. And so this was something that they initiated. The first center in Detroit was created in 2013. And so since that time, they've seen an increased number of students enrolled in early childhood education. They've seen also returns on investment as it pertains to their high school population and the students they serve there, with increased numbers of children going to graduating and then also going on to secondary educational opportunities. And then they've also seen through their wraparound services, people accomplishing exactly what we're looking to do, which is less people depending on government dependence for resources and benefits.
You're doing a great job, and hate to monopolize the time, but and I'm very intrigued. The early age child care, as the young lady had mentioned before, the early age child care. Is there an educational component to that, and are you working with private daycares? Are you working within Head Start programs? What's the model for that? And I'll show you.
So Tennessee, TQEE, Tennesseans for Quality Early Education, is one of our key partners. We have one of the only Bright Start Fellows. We have the only Bright Start Fellow in West Tennessee. So we've already been working for the past year to build a network, what we call the Bright Start West Tennessee Network. And so one of the things that we've discovered, and we've known this for a while, actually I spent 2.5 years in the early childhood space, is that we have a severe lack of centers, as was mentioned earlier. To give an example of that, in Madison County alone, back in 2001, when DHS began to track licensed child care centers, there were 83. Today in Madison County, there are 23. And so there's been a significant decrease in these child care centers. So part of what we're doing is partnering with Dyersburg State, which has a TECTA program, Jackson State Community College as well, to incentivize and encourage more people to go into that field, so that we can then turn around and create more centers, so that there are more options for families. And so that's a key part. The other part that we're doing through the Bright Start West Tennessee Network is also incentivizing those centers themselves by helping them attain high-quality training for the educators they already have. And so that will look like a $10,000 a year incentive for them to be a part of this network, to partner with us to increase the number of slots that they have, but also to provide greater training for their teachers, and also to serve as mentors for new people interested in starting new centers.
This is where Commissioner McCord sings. Is this the karaoke part of the?
You're going to have to move away from the light, though.
Okay.
All right.
So just a comment, I applaud the connection with Ford, because that's the first time we've heard that too, and it has a potential for being a prosperity engine for West Tennessee as well. And all indications are they're going to be a wonderful corporate citizen there, and to engage that is very good.
And I think as we close, as we talk about Ford, the largest single industry investment in the history of our state, it will transform West Tennessee. And so there is a two-gen approach to this, as you've seen, primarily because we have to prepare our West Tennessee workforce for that coming investment. And then we have to make sure that it's successful once it's here. So as we close, I want to point out that our theory of change is located in our logo. You see two children holding hands together, and it forms a W. And you see the adult over them with a T. Because in West Tennessee, we believe that in order to create change, we have to go be hand in hand, and we have to wrap our arms around our most vulnerable. Thank you.